is Dr. Green for 5 minutes.
Thank you, Mr. Chairman. I appreciate having the hearing, and of course, Ranking Member Scalise. I want to thank our witnesses for being here today. During the last hearing, I just want to clarify some testimony that I provided. I think it was misunderstood by Mr. Raskin. I've spoken to Mr. Raskin, but I want to make sure that it's on the record. When I spoke about natural immunity in the study out of Israel with a sample size of 700,000 people, showing that natural immunity was 27 times better than the vaccine, I was not arguing that the vaccine was not effective. For people who are at risk for bad outcomes for COVID, the vaccine is a great choice. So I want to make sure that's clear, and I did clarify. I caught Mr. Raskin offline, and we spoke about it, but I just want to make sure everybody understood. What I was talking about was this natural immunity that is showing itself to be better than the vaccine, and yet we're not considering natural immunity with vaccine mandates, and we're firing people, we're kicking people out of the military who might very well have a better answer than the vaccine. So that was my point with testimony last week. I wanted to clarify that, and thank you for that.
Very good. Thank you.
You know, my biggest concern with our committee has been, and I think y'all have heard me say this many times, what we're not talking about. And you know, a quick example, I flew back from Brazil. I went down to Brazil to meet with leadership down there, to talk to their military and about joint military stuff, and all this as a part of my responsibilities on foreign affairs and as the ranking Republican on Western Hemisphere. When I came back, I had to have a negative COVID test. Yet thousands and thousands of migrants are coming across our southern border. They're not getting COVID tested, and our government is sending them all over the United States. It's as if we're seeding COVID all over the country, and we're not talking about that in this committee. We should talk about that in this committee. I mean, that's a big, big deal. And of course, the heavy-handed lockdowns. I'd love to spend some time talking on that. I think that those government officials, you know, created an unmitigated disaster with consequences that are going to be felt for years. Small businesses forced into bankruptcy, unemployment. As a physician, I'm very concerned about the long-term effects of delayed cancer screenings and preventative care. I think most people here know that I had colon cancer, and I went to combat too. I don't have survivor guilt from the war, but I do have some survivor guilt from the cancer ward. And when you're sitting in a chemo chair getting chemo and you become friends with a person who comes every other Tuesday with you in the chair next to you and they die, you have to live with the question of, why wasn't it me that died? Yet here we are with all our lockdowns. There weren't cancer screenings for months. Thousands of undiagnosed cancers will kill Americans. We didn't consider the ratio. We won't look at the numbers. We won't talk about this. And even today, I talked to my oncologist this week, 30% below our pre-COVID levels of colon and breast cancer screening. We're still scaring people to death, literally, because they're afraid to go get their cancer screenings. School closures forced millions of students to substitute screens for classrooms, and it has led to a massive setback in our educational progress for those students. Not to mention the very well-documented toll on social isolation and mental health. As an ER physician, I would see people all the time coming in with suicidal ideation, with suicidal attempts, and when it's a young person, it rips your heart out. Yet we're not talking about that. In fact, while we know for a fact that there's been a 30% increase in ER visits for mental health issues amongst teenagers and a 50% increase for women, the CDC hasn't released the suicide data for last year. Why? Well, we ought to know that in the midst of this pandemic, if we're going to balance out how many we lost to the vaccine with or to the virus, well, how many did we wind up harming, killing with the bad lockdowns? Well, I mean, we should look at that data. I mean, why aren't we talking about those things? You know, I'm a clinician, and I'm also an ER physician, so I think very practically. I have so much more to talk about, Mr. Chairman, but I'm running out of time. But I'm
think-
concerned about what we're not talking about in this committee. And last week I talked about the origins of the virus. We haven't yet talked about that. I'm out of time, but I yield, and thank you.
I assure the gentleman that the ranking member did talk about that, as you can imagine.
I bet he did.
The chair now recognizes Ms. Velasquez for 5 minutes.
Thank you, Mr. Chairman, for this important